Dr. Sellers Educate. We're so happy that you're back as you continue to move forward on your journey towards CNE success. We are continuing our snapshot and looking at exam analysis A to Z. We're going to be focusing on the letter H for high stakes testing in this snapshot. All right, so let's go ahead and take a look at our content. From A to Z, what is it that you need to know for the CNE exam? And I would add, to better clarify when we look at competency or domain 3 and domain 4, what are those specifics that you need to make sure you're knowledgeable about as it relates to high stakes testing? If you want to go ahead and pull out your study worksheet, you want to go ahead and print that out. And you can write today's date, whatever date that is for you that you're watching this episode. And then you want to go ahead and make sure that you pull out your exam blueprint from your candidate handbook. In case you haven't heard, NLN has updated the CNE exam blueprint. Okay, so if you want to go ahead and print that out now, you can always pause this video and come back when you're ready. But starting on page 7, is where you see domain 3. No longer are they named competencies on the exam blueprint. They are now called domains to align with the essentials is what we think. And then you take a look on page 8 and you see domain 4, participate in curriculum design and evaluation of program outcomes. Under A, number 3, graduation, we know that there are some universities, some schools of nursing that do incorporate high stakes testing as a requirement, and specifically students have to achieve a certain score before they are allowed to matriculate and graduate, or perhaps even be approved to sit for the NCLEX exam. That's what this session is all about, just taking a look at what are those 3 key steps that you want to consider as you take a look at the high stakes testing policy that you have in place. What are those 4 key steps to avoid appeals? Maybe. You see, we have a question mark there because we know high stakes testing can be a very sensitive topic when you think about the impact that it can possibly have. So first, let's take a look at the introduction to high stakes testing. First of all, it is a critical part of nursing education to ensure nursing competency. We often think about high stakes testing being part of an ATI benchmark, if you will, or a HESI threshold related to the score that we expect students to achieve. But it's also a part of competency checkoff that we require students to achieve, whether that's a mid-calc exam or our skills checkoff for inserting an IV like you see here, or taking blood. I think this is actually taking blood, a blood sample, or it could be inserting a Foley. There are several requirements in our nursing programs that do qualify under this category as high stakes testing. Practice and preparation are key for clinical skills. We know that this is required in order for our students to demonstrate competency and ultimately provide safe patient care. But what about didactic? When we think about the classroom learning, it is aligned with the cognitive learning domain for Bloom's taxonomy. On page 188, starting on page 188 in Teaching and Nursing, that's Billings and Halstead, 6th edition, you're going to see a Bloom's taxonomy for every single learning domain. There are 3 learning domains: cognitive, affective, and psychomotor. The question we have here is it necessary? Is it necessary to have high stakes testing in the didactic setting to evaluate cognitive learning? Something to consider. And the next question we want you to consider is, are there equity issues with high stakes testing? We know that people of color, specifically African-American students, there has been research completed and they can struggle when it comes to standardized testing. So are there some equity issues? And is there an opportunity to level the field when it comes to students' ability to be successful on a high stakes testing exam? We know that NCLEX is the ultimate high stakes testing exam. How do we best prepare students for success? Avoiding failure, that's what this is all about. How do we support our students and ourselves to ensure we're closing knowledge gaps? And this is one of the keys to success. Okay, so to ensure that you are successful on the exam, you, first of all, as we talked about in our previous episode, that knowledge assessment piece, focusing heavily in the area of application and analysis. The C&E exam is aligned with 3 different levels for the cognitive learning domain. First is going to be recall, next is going to be application, and last is going to be analysis. Okay, so more than 70% of the questions are at those 2 higher levels. In order for us to avoid failing the C&E exam, a key to success is having an understanding of the detailed exam blueprint and mapping back to the content that we talk about here on our YouTube channel. Every single week, we published a new episode. So make sure you go ahead and subscribe right now if you haven't already, so you'll be alerted right away as soon as a new episode is released. Our thought-provoking question today says that the nurse educator is preparing a new exam in a health assessment course. Which of the following statements best describe the purpose of high-stakes testing in nursing education? We have 4 options. A is to ensure standardized evaluation of nursing students' knowledge and skills. B is to create unnecessary stress and anxiety among nursing students. C is to restrict the curriculum and focus solely on test-related content. Or D is to promote subjective assessment methods for nursing programs. So think about those 4 options. Remember that when you get to a question on your C&E novice or C&E clinical exam, we want you to think about 2 things. First is, what do I know for sure related to the content in this question? Okay, and then second of all, what is it that is realistic regarding this question? Okay, so thinking about which answers are the most sense, make the most sense. And then second of all, what is it that I know about this content? Okay, so if it's unfamiliar content, you want to look at perhaps the 4 choices that you have. You want to go through the process of elimination. But number 1 is, what do I know for sure? And second of all, what is it that I need to do to close my knowledge gaps related to this content now as you're thinking about these thought-provoking questions, okay? So our 4 key steps for nursing programs in order to, again, at least decrease grade appeals, hopefully, or appeals period when it comes to high-stakes testing, possibly determining whether or not a student will matriculate to the next course or even to the next module, right? So it just depends on how you have your high stakes testing set up in your actual nursing program. So number 1 is to provide adequate notice of the requirement. We want to include the language in the syllabus. We also want to talk to students about it. At the beginning of the semester, we want to make sure that we're answering our students' questions related to the actual exam and how they will be evaluated. Or it could be, like I said, something as simple as a skills checklist. Number 2, we want to make sure we're supporting students who do not achieve the desired results before facing the consequences. So taking a more proactive approach versus a reactive approach, this is going to allow students to increase not only their knowledge level, but also their confidence and their comfort and their ability to demonstrate the skill. Earlier, I talked a little bit about the fact that the research shows us that people of color, specifically African Americans, do struggle with standardized test taking. And it doesn't mean that we are going to allow those students not to take standardized tests. It just means, like it says here under number 2, that we are ensuring that we are providing support to create equity in the classroom so that our students have the additional support and resources that they need. Okay, so there's still a responsibility on the student in order to decrease their anxiety related to standardized test taking, because again, NCLEX is a requirement for all students to pass before they can be licensed as a registered nurse. Number 3 is to use multiple assessment methods for determining outcomes, such as a graduation requirement. All right, so we should have a list of requirements for students to matriculate or progress in our nursing programs and for graduation. So a high stakes testing should not be the only requirement for students to matriculate. There should be a lot of formative assessments where we're giving students feedback. And we also should have specific assessment tools that are going to give us an indication once we scaffold their learning. We should also scaffold our evaluation strategy. So it's not a surprise to the student when they are not competent with the skills specific to high stakes testing, or when they don't do well on a benchmark exam, because we've given them quizzes, we've had discussions, we've had unfolding case studies, we've engaged with our learners in a way that they are receiving a lot of formative feedback so they can make adjustments and then ultimately be successful during that high stakes testing. And number 4, which is really important, make sure we are consulting with our state boards of nursing for any specific state requirements regarding utilization of standardized testing. Okay, so number 4 is really important. We always want to be compliant with our boards of nursing when it comes to alignment with what our nursing program standards are and what the Board of Nursing says that they have to be. There are 3 types of high stakes testing in nursing that we want to highlight. Now, there may be more than this, but these are 3 very common ones. Number 1, we've talked about the NCLEX exam. Number 2 is Halstead-exam. So this is used for nursing school admissions and to predict student success. Okay, and then 3rd is that ATI exam that allows us in nursing programs to evaluate students' knowledge and readiness for the NCLEX exam. So one of the big takeaways is that high stakes testing can be used as an excellent tool to predict and really to better equip our nursing students before they sit for the NCLEX. So we just want to make sure we're following those 4 key steps to help decrease appeals from our students and ultimately to increase success of our students in the nursing program. So other benefits, it's going to allow us to ensure that our nursing students are knowledgeable and competent, which does directly affect the delivery of safe patient care and ultimately really good patient outcomes. All right, so let's take a look at this thought-provoking question. If you chose A, you are correct. Okay, so the nurse educator, when preparing a new exam, the goal and the purpose really of high stakes testing is to ensure that we have a standardized objective evaluation of nursing students' knowledge and skills. Okay, so that is the intent, that is the ultimate purpose of a high stakes testing exam. So give yourself a pat on the back if you chose the correct answer. If you did not, go ahead and write it down on your study worksheet that this is a gap area for you. Remember that is the purpose of showing up here every single week and using your study worksheet as a guide to identify what gaps you may have. There are some risks and challenges associated with high stakes testing. First, it can cause and really contribute to undue stress, burnout, negatively impacting patient care. We want to consider other alternative ways to evaluate and really validate that learning has happened. Next, let's talk about some of these strategies to help students be successful on these high stakes exams. First is to practice mock tests using test taking strategies like process of elimination and helping students manage the stress. We all know that when we take exams, just like taking the CNE, it can be extremely stressful. So just think about what strategies can we put in place to help decrease some of that stress so students can focus on validating through the exam their knowledge and competency related to content. All right, so any efforts that we can put forward to help decrease some of these factors that can contribute to failing a high stakes testing exam, we want to make sure that we're incorporating those steps and those strategies as much as we possibly can. And I would just say lastly is supporting student success starts with having a healthy student-faculty relationship. What that looks like is I role model civility. So I show up on time for class, that I am committed to my office hours. So I'm available for my students to answer any questions that they may have. And I am open to having discussions during my exam review about muddy points that students may have. Okay, so there are some soft skills associated with strategies that we can use to support student success as well. And then as we wrap up, I'm just remembering that high stakes testing in nursing is a necessary component of ensuring we have implemented and really evaluated and validated that students can practice safely and deliver quality patient care. We know that competency is critical in nursing, and we must ensure that that happens with our students, taking a proactive approach, checking with our Board of Nursing And ultimately, we don't want to surprise our students, right? We want them to feel prepared with the knowledge and the skills that they need to be successful on a high stakes testing exam. All right, we hope this has been helpful. Until next time, reach out if you have any questions, and we hope you have a great rest of your week. Thanks, everybody. Bye-bye.